Good morning, YouTube. This is me, Kimmy Woo, coming to you all with a brief update. Well, I hope it's brief. First, I want to say thank you for all of my new subscribers. I really appreciate it. I want to thank you all for commenting on my previous videos, giving me some inspiring words, inspiration for me to keep pushing forward, and all the encouragement. I really do appreciate it. It has helped me out tremendously, and I want to thank you all for that. I am still learning how to do this YouTube thing for us, like commenting and responding to all of the comments. I do see them. I try to respond back, and hopefully you all receive them. I'm not sure, but I'm learning. Right now I am actually recording on my tablet. I have a Samsung tablet. I love Samsung. I'm not team Apple, but I am team Samsung. But hopefully I do it correctly. First off, I want to say thank you again. And I had some few appointments this week. I finally got my lab results back. One of them, I had some testing done from my GI doctor just to make sure that I do not have any Crohn's disease or anything of that nature. But those results did come back negative. But I'll get to that in a little bit later. But I did have an appointment with my rheumatologist Tuesday, and he did some blood work. He checked a lot of chemistry, which is like my creatinine, my function for like with my kidneys, glucose and things like that. He also checked my complete blood count because I told him I was tired. He checked my B12, that was normal. He checked my thyroids, that was normal as well. My vitamin D has come up, so since my vitamin D is over 40, he said, which was 60, I can come off my weekly vitamin D and start taking daily vitamin D tablets. But I don't know about that. I prefer taking it weekly. So I'm going to finish up what I have. I have a couple more weeks of that. So I'm going to finish up with that. And then I may start on the Caltrate. I think he said Caltrate D. So we'll see. But one testing in particular that he did is called the anti-histone. And that checks for drug-induced lupus to see what my levels are. Initially, when I went to see my rheumatologist, my levels were like 2.9 initially when I saw him in May. That prompted him to think that I do have drug-induced lupus. So he took me off of my hormone patch and to see how I would do. So in the meantime, I had a follow-up appointment with him, and he checked my levels again, which was like in July. And it went down a little bit. It was 2.4, so from 2.9 to 2.4. It did a little decrease. So he did it again he drew the blood again this past Tuesday. And it came back higher than it did when I first got diagnosed. It had went up to 3.9. And so now we're trying to figure out, okay, since you're not taking the hormone medication, why are your levels still elevated? So we're trying to figure out what it is. So we actually think that it's my heart medication, which is atenolol, because I have been reading that it can cause some inflammation and cause drug-induced lupus. So I kind of suspected in the beginning that it could have been that medication. But recently since I've been having so much heart issues, my cardiologist increased my atenolol to 2 a day. And I can tell that once I start taking the medication twice a day, I have begun to get the pain again, like in my bones, in my knees, in my joints and things like that. And I was like, I'm beginning to feel a little bit tired again. So I sent him a message, my cardiologist, and let him know that since I've increased the atenolol, I've been getting more aches and pains. And also I've been having more heart palpitations with that medication. It's just not working out for me. So I'm not sure. So he said just decrease it back to one a day. So when I finally got my results back and I saw that my levels were higher than they were initially. So my rheumatologist suspected that it could have been the atenolol. I also take cholesterol medication. I don't have very high cholesterol, but they put me on that, especially with lupus. You can have, coronary artery disease much worse than you could be like some normal person that that does not have lupus or anything like that. So they put me on that. So he said it's unlikely that it's your atorvastatin or the statin medication, but he think it's the atenolol. So I contacted my cardiologist and I let him know that my rheumatologist suspect that it could be my atenolol that could be causing more issues. So they called me in another medication, and I am beginning to feel a whole lot better since I stopped taking the atenolol. The medication that he put me on helps with atrial fluttering, which I have heart fluttering. And I can tell since I started taking that, I began to feel a lot better. So I had an appointment the same week, which is this past Friday, with my GI doctor. And she said, of course, I do not have Crohn's disease, but she said, you know what? First, she asked me, have I ever been on steroids? And I told her, no. I've been asked that from my pulmonologist if I've been on steroids. She's like, I think that you would benefit from steroids, but I do not want to put you on a high dosage, and I don't want you to be on it long term. So she put me on a very small amount I think she wanted me to take it for, I'm reading here, I think she said 6 to 8 weeks, but it's a very small amount. It's 3 milligrams. So I'll take it 3 times a day. And it's called Intocort, which got the generic brand. You gotta do what you gotta do. Save money. All these doctor bills I have, I am racking up doctor bills. I tell you, it's a lot, but gotta do what I gotta do. So she put me on 3 milligrams, which is 3 times, and take it 3 times a day. I've been taking it, and I can tell a significant change. And she was like, when I put you on this, she said, you're going to call me back in 3 or 4 days and you're going to thank me. And it is so true. I can tell a huge difference in how I'm feeling. I'm still having joint pains in my knees. I'm not sure about that, but it's a lot better. It is a lot better. I will say that. And I'm totally not for take medication. That I always hated taking medication. I really do. But I had to do what I had to do, and it's helping me. But I just don't want to stay on this long term. But now I'm easily to get bruises. I'm not sure. I woke up one morning and there was like this huge bruise like on the side of my leg, and I had to ask my husband like, oh hey, you kick me while we were sleeping in the bed last night? You're like, no, but I woke up with a bruise. And then I just noticed the day before yesterday, and there's another bruise like on the inner side of my leg, on the same leg. So I sent a message to my rheumatologist because I think the Plaquenil, which is they call it anti-sticking medication, meaning for like your platelets, it said it can help also with plaque in your arteries to help keep your blood flowing and keeping it from sticking to your veins and your arteries, and well, not veins, your arteries and things like that. So I believe that it's similar to like a mild blood thinner type thing, if you want to say, give or take. And I think I'm looking now, yeah, the bruises are still there, but I think I am getting some side effect from the Plaquenil, which caused me to bruise easily. So I'm going to keep a watch out on that. And I've been having still having some blurred vision in my right eye, so I'm going to watch on that as well. But my rheumatologist also recommended that I get the flu shot. I was totally against the flu vaccine, but he strongly suggested that I do receive the flu vaccination. And there's a particular one that he wants me to get, the one that protects against, I think it's the 4 strands. I think it's 3, but they give me an extra one because the patient with lupus had to have a certain type of flu vaccine. So I got that this past weekend. So overall, I'm feeling a whole lot better. I'm doing what I have to do. I have to watch my diet because my GI doctor thinks that I'm having some type of allergic reactions to either dairy, seafood, eggs, or gluten. So this week I'm cutting out on my dairy. It's kind of hard when I'm here with Starbucks. It's crazy. But I'm cutting back on that. I'm trying to use almond milk. But this week I want to stay clear of dairy products. And then I'll try to do away with some eggs, and just to see what it is that irritates me. I think I have an idea. I think it's actually dairy, but we'll see. And then, like, of course, seafood. I love seafood, so that's gonna be hard. Other than that, I'm feeling okay. I'm gonna keep pushing forward. I'm gonna do what I have to do, and just maintain a healthy lifestyle. Thank you all for watching my video. I really appreciate everything. I hope everyone enjoy their day. Hope everyone enjoy this fall weather, depending on where you are. Stay warm, because it's gonna be very cold, I hear. But I'm here in Georgia, and it's not too cold, but it's kind of cool, like in the 40s. That's cold to me, and I'm very cold. And one other thing, I don't know, my rheumatologist had mentioned to me about taking, I think I said this already, Viagra and Cialis for my Raynaud's. I have not tried that yet. I'm still leery on that. I can deal with the coldness in my feet and hand for a little while, but I'm not too sure about starting any other medication, especially if I can try to go with it as long as I can. But I'm doing well. Enjoy your day, everyone. I thank you so much, and I will come back with you with another video. Talk to you later. Much love to you. Bye.